This is a plan to create an entirely new government-dominated health care plan, raising taxes and not paying doctors, among a bunch of other flimflammery that's in the bill.
2,074 pages long. It's enough to make you barf.
I mean, to me, this whole bill basically guts Medicare, raids Medicare.
What it's going to do to our seniors is I have a message for you. You're going to die sooner.
Just look around and see what they're doing. It's continued delay. They've slow-walked the health care bill month after month after month. Now that it's finally on the Senate floor after we got cloture, not one Republican out of 40 wanted to allow us to even debate it. We got no Republican votes to move it forward. So once the debate starts, the slow walk continues. They keep trying to deny and delay. And let me just kind of show you some things. They started with one of the charts they have looks like this. Cuts, they say, cuts to Medicare, hospitals, nursing homes, all that. First of all, the Senate health bill strengthens Medicare. It saves America's seniors money. It makes prescription drugs more affordable. We close the donut hole. So for them to stand on the Senate floor and make the argument that they're protecting Medicare and the Democrats are cutting Medicare is just not credible to anybody. Nobody believes them. They know that. Therefore, they try another little myth. Second myth that they do. Here come the rationers. I mean, it's absurd as there are other myths, but let me tell you what rationing is. What rationing is what the insurance companies do every day of the year. I go to the Senate floor almost every day in the last 3 months, reading letters from constituents in Ohio, from people from Toledo and Lima, from Gallipolis to Zanesville, from Youngstown to Dayton to Springfield to Mansfield. And what I hear from people over and over is they thought they had good health insurance, then they got really sick, and the insurance company rationed care. They took their health care away. Or sometimes people thought they were doing okay, they had decent insurance, they had a baby born with a pre-existing condition, they lost their health insurance because the insurance companies rationed care. That's rationing. I mean, we have all kinds of rationing in this system. The difference is what we'll have with this health care bill is an end to rationing. The last thing they like, this is their answer to everything, that the government's taking over everything, everything's government owned, that this is a government takeover of the healthcare system. Well, first of all, they're wrong. What they want is an insurance takeover of the whole healthcare system. The biggest problems in the healthcare system are those caused by insurance. Rationing by insurance companies, cutting off people for pre-existing condition, denying claims, all that they do on all that private insurance companies do. At the same time, private insurance profits 400% increase in the last 8 years. The CEOs of the 10 largest insurance companies, their average salary is $11 million. The Aetna CEO made $24 million last year. You got to deny a lot of claims, and you got to cut off a lot of people based on pre-existing condition, discriminate against a lot of women, which, you know, private insurance companies charge women more than they do men. You got to do all those things to pay a $24 million CEO salary and to increase your profits 400% in the last 8 years. In no way is this a takeover. The public option is an option. People can choose the public option. They can choose private insurance. It's clear to me that this legislation works for the American public. These myths simply are that. They're myths. The Republican efforts have been to delay, to obstruct, to say no. They've done that throughout this year. It's time that Republican stalling stopped. It's time that all these myths, we explode these myths so that people understand that this legislation works for the American people. And my proudest moment as a member of the Senate, my proudest moment in my career will be sometime either this month or next month. I'm going to vote aye on the most important piece of legislation that any of us have worked on in our careers, and that's passing this health care bill. Thank you.